respiratory the adaptations to aerobic training by talking about the respiratory side of things. So here are the two outcomes that we're going to try and get through with this video. So when it comes to aerobic training, and the same is true of anaerobic training, there aren't any changes to the pulmonary structure. Like, one of the things about the lungs is you can't really change them. They don't get bigger, they don't get stronger, they don't get any of that. When you damage them, it's hard for them to get healthy. Okay, and so this was a common myth, at least something that I was told when I was a kid by my grandpa all the time. So my grandpa used to be a smoker, and he told me that his doctor said that if he ever stopped smoking, it would take like a year, and then his lungs would be back to, he would be typical for his age. And that's not really the case. Okay, your lungs you can't change the lung structure. So if you damage them, they're going to stay damaged. They don't really heal well. And you're not going to really make them better or stronger. But we can change how we use them. Okay, so after training, our ventilation actually decreases by 30% during submaximal exercise. And the way we do this is we increase tidal volume and we decrease respiratory rate. So in other words, we're getting more bang for our buck. So for one breath, we're bringing in more air, more oxygen, okay, and it's not costing us as much. Now remember, okay, so the benefit is we're going to get more oxygen extracted per breath. And so part of this has to do with our alveolar ventilation, okay? And so we can actually maintain our alveolar ventilation but decrease our minute ventilation because we're taking bigger breaths, all right? So let's say that normally we're taking a breath of air that's 500 mils, and I've got 100 mils that's dead space. So that means 400 mils is getting into my alveoli every breath. Well, let's say I start taking breaths that are a little bit bigger, okay? So now I'm getting 500 mils, so I just increase it by 100. Well, so that's a 20% increase in my tidal volume, but I'm actually getting a 25% increase in my alveolar ventilation per breath. Okay, and so I'm breathing less, so that means my diaphragm's doing less work, but I'm able to get more oxygen per breath. Okay, so this reduced respiratory rate, like I said, more oxygen extraction per breath. There's less ATP going to the respiratory muscles. Okay, so in other words, we're reducing respiratory steal, and that allows more oxygen to be delivered to active muscle. Now, during maximal exercise, our pulmonary ventilation increases, and this happens by increasing respiratory rate and tidal volume. Okay, so we're able to kind of increase, or we do a better job, or bring in more air. The last thing that we would need to think about is diffusion. Now, training doesn't affect diffusion at rest or submaximal exercise. Remember, we're all about being efficient, so we don't need to necessarily increase diffusion capacity if we're getting enough oxygen. However, diffusion capacity increases during maximal exercise, and we've actually already mentioned previously how this happens. So we can increase pulmonary blood flow, which opens up more capillaries. We can increase our ventilation, which means we're going to recruit more alveoli. All right, so as a result, we're getting more blood flow, we're getting more ventilation, so we've got a better, arguably we have a better VQ matching. The last thing is the difference in the the arterial to venous oxygen content. So that's what we call this delta AVO2. Now, before training, for every liter of blood that goes through muscle tissue, we pull out about 50 mils of oxygen, okay? And that's about 25%. At maximal at maximal exercise, we can pull out 150 mils of oxygen. Okay. Now, after training, notice we don't change rest because rest is what it is. Okay. But during maximal exercise, we're pulling out potentially 200 milliliters of oxygen during maximal exercise. Okay. We're pulling out almost as much oxygen as we possibly can use. Definitely a higher percentage. So we've increased by a third, right? So 50 divided by, we increased by 50 mils. So 200 minus 150 equals 50, okay? And we started with 150 mils, so that's an increase, that's an equal sign, 33%. That's a 33% increase in oxygen extraction. That helps us to be more efficient. Okay. So, endurance training, like I said, has no effect on submaximal AVO2 difference, but it increases the maximal AVO2 difference. Okay. And we can do this for a variety of reasons. One, we're going to increase the number of capillaries, which we talked about the cardiovascular section. And so we're going to allow more oxygen to go into the muscle cell. And so as a result, this tied with redistribution of blood flow and our increased ability to extract, this will be helped, that's the word I'm looking for, by our ability to redistribute blood flow and just the increased ability of the muscle to extract oxygen. And we're going to talk about what the muscle specifically does later on.